welcome to our series Heart Talk that is dedicated to create awareness about the heart condition or heart defects in children. This week globally is recognized as the CHD or Congenital Heart Defect Week. I am Priyal Guliani, representing Genesis Foundation and their heartening message, Har Dil Dhadakna Chahe. Like the trustees or founder trustees of Genesis Foundation, Prema and Jyoti Sagar, my husband and I, we both had a similar journey of losing our child to CHD. And together now, we are looking at various ways to create awareness and provide support to CHD warriors and their families. I'm grateful to Genesis Foundation for giving this platform. Today, I am delving on a topic that's very, very close to my heart. As a CHD mother, there are so many questions that I had that needed handholding once I knew my child had that diagnosis. And we have today a very special guest joining, Dr. Nihar Parikh. Thank you so much, Doctor, who's a well-known pediatrician and also someone that we've all learned a lot from for last so many years as his Instagram followers, his wisdom of knowledge and his support that he provides to various parents and their tons of queries for raising child and related to their child. Thank you, Dr. Parikh, once again for joining us.
Priyal, thank you so much for this opportunity. I must thank you guys for this amazing noble cause. For you, it's a personal journey, but I'm sure this initiative of yours, along with your absolutely well-deserved partners, is going to make a lot of difference in people's lives. I think spreading awareness is extremely important, gives people confidence, gives them the ability and a feel that they can handle anything. And there are people out there who've been through their journey and is going to make it simpler for them.
Yes. Dr. Parikh, I would want to start by asking a very important question. Is that, like in my case, many CHD, I know that we've dealt with it in our previous part of the series as far as the diagnosis and screening is concerned. But there are also still remain a lot of cases where the diagnosis do not happen during the course of pregnancy. And therefore, it becomes imperative as to what happens once the delivery happens. Are there any standard protocols for that assessment? Because we do understand that the earlier the diagnosis is, the better it is in various cases. So what as a parent or as as a standard course is something that is very imperative to check when a baby is born or for the early detection or screening of CHD?
So basically, like you said, the antenatal screening is the key. So it mentally prepares the parents, mentally prepares us as pediatricians and our team of neonatologists to categorize this child as a high-risk delivery or a low-risk delivery. But many a times, if the congenital heart disease is too small or doesn't have any impending kind of pressure on the heart or any failure symptoms, the only way we come to know is when we have the child in front of us when the baby is born. Now, obviously, if it's a complicated congenital heart, we are already prepared for it because we are duly warned by the gynecologist and the sonologist prior to delivery. But if it's missed for whatever reason on the delivery table, a complex congenital heart very rarely but does present itself with a very low APGAR score where the child does not have that strength, or the newborn's heart does not have that strength to have the first cry. The baby's born as a limp baby. We have to resuscitate the child, or a blue baby, where the heart is the number one cause of the inability of the baby to kind of take its first breath. Now, if this is a very rare occurrence, because if the congenital heart is severe enough, we already know before the baby is born that we are expecting this. Most of the times, it's the presenting features are not very severe, and that's the scary part. Many a times, these kids, are born with a normal APGAR score of 8 and 9, and the first few days go pretty uneventful. There's so much happening on the delivery table that we do conduct a primary scan. If it's a very small mama with the newborn's heart racing away to glory and it's crying away to glory, sometimes the murmur can be missed. Hence, the second day and the third day examination of the pediatrician of the newborn in the hospital before the baby is taken home by the parents is of key importance. Preferably on the second or third day, if the pediatrician reaches the point where the baby is sleeping, it's very easy to kind of auscultate a missed murmur and ask for a 2D echo immediately. 2D echo, I would say, is a God's gift to congenital heart diseases, because if done by the right person in the right hands, that is pediatric cardiologist, there's hardly anything ever missed. Now, once the baby is in the hospital and we diagnose a congenital heart, the preparation of the mental state of the parent, preparation starts there, whether it is a complicated or a simple congenital heart, whether it's a wait and watch game or we need to take surgical measures straight away. But now let's go to the third most scary scenario, where everything is missed and the baby goes home. And the first few signs in the first 7, 10, 15 days is when on the 10th day we ask for the parents to come back. And hence, this is why the 10-day visit is equally important, where we expect the baby to put on its lost birth weight, and the baby's weight should come around near the birth weight. Post that, we do expect a weight gain of 25 to 30 grams a day. And the constant struggle of a parent to have a child that's finding it difficult to feed, that's not taking enough feeds, that's getting breathless, where every time the parent puts the hand on the baby's chest, they hear the heart racing away even when the baby is sleeping, what is called as palpitations and tachycardia. When the baby finds it so much of a difficulty to feed, that during a feed, every few minutes, the baby has to stop, take a few breaths, and feed again. Every feed that the baby takes is like a workout session for the child, and the child just doesn't put on weight even after the child consumes near adequate milk. This is known as a suck cycle, which is a pathognomic sign of an early congestive cardiac failure, most commonly to a congenital heart disease. When we auscultate the newborns, murmurs are a key importance. In today's day and age, no murmur should be left on it being a physiological murmur. I think having the murmur diagnosed, whether it's physiological or pathological, is the key. With a simple 2D echo, our 2D, our pediatric cardiologists are tremendously skilled and extremely patient to even screen the smallest of the smallest newborns for a congenital heart disease. So I think a failure to gain weight, difficulty in feeding, constant perspiration of the child while feeding, constant irritability of the child. In more prolonged cases of missed congenital heart disease causing congestive heart failures, the baby puffs up, swelling of the hands, swelling of the feet, turning blue, a cyanotic baby of the lips, especially when a lot of parents are mistaken that every blue, kind of bluish discoloration of a newborn child is normal. No. Peripheral cyanosis, what is called is turning blue of hands and feet, is very normal. But central cyanosis, that is turning blue of the lips, irrespective, whenever, however, no matter how big your child is a red flag. So that is the time when further investigations need to happen and the parents need to look out for this.
But my question now is that, the biggest challenge that I've faced was that as a new mom, how do I treat my child differently? I mean, is everything I would judge is it normal or is it not normal? Is it normal in the sense of like, okay, if she's coughing or if he's coughing, whether that cough is a normal, whether that burp is a normal, because you do not know, because of the underlying condition, you're always second guessing that every action is whether it's right or not. And more importantly, the immunity is being built up at that age. So the fever doesn't remain a fever, right, when it's in an underlying condition like this, isn't it?
Correct. So, every parent has to remember that every congenital heart disease, whether it's complicated or not complicated, has a treatment, has a protocol. Some have simple medications and playing a wait and watch game. Some require surgeries, which are one-step surgeries. Some require two-step surgeries. Some don't require surgery. Some require device closures, which can be done through catheterization. So in today's day and age, there are options in form of invasive, semi-invasive, non-invasive treatment for every congenital heart. Now you have to remember, a congenital heart is a compromised heart. Means a congenital heart is working twice as more as a regular heart to keep all the functions of the baby growing, including growth, including immunity, including breathing, including everything that the baby does, is basically a heart which is slightly compromised. The minute a congenital heart is diagnosed, the certain medications which can be diuretics or what we call as ionotropes, which are medications to help the heart work faster, stronger, and reduce the afterload, means the work against which the heart has to pump is also reduced. These are combination drugs started very easily, very fast, extremely safe to be given long term to reduce the overall workload of the heart, to prevent congestive cardiac failure setting in or pulmonary hypertension setting in. Now, these drugs will give a near normal life to the newborn and has to be kind of reassured to every parent that look, once these meds are on, your child heart is going to behave and perform normally. Throughout the process, we are going to monitor the baby's growth. Growth is a key factor relating to the immunity of the child. Weight gain equivalence is directly proportional to the immunity. The better the weight gain, the better the immunity. The lower the weight gain, the lower the immunity. Is something that every parent should remember. So if your child is putting on good weight with a congenital heart, means you're doing well, the baby's immunity is growing. This is also important because then the parent need not panic about the slightest cough and cold. Yes, there are certain medications you should be extra careful of, certain cough syrups that are bronchodilators that can put extra pressure on the heart, and that is something that we should not do. But all these do's and don'ts is a part of our job to tell the parent. It's a part of the job to explain the parent, look, once these meds are on, your child is protected. The only thing we need to do is make sure the baby puts on good weight and monitor the congenital heart every 3 to 6 months with 2D echoes to see how the heart is developing and how it is growing. Sometimes it's done to buy time till the child puts on enough weight to undergo the first step or the final step of the surgery. Because every surgery done to a congenital heart, if it's fully invasive, if it's an open heart surgery, it is a super complicated mega surgery, which post surgery the parents have to be mentally prepared for a slightly long drawn period and window of recovery. But once these surgeries are done, either in a single step or a multi step, it is usually a lifelong correction. These kids can climb Mount Everest, they can achieve Olympic gold medals, they can follow all their passions, all their dreams, absolutely unrestricted.
Doctor, that brings me to a very important question of whether it's a myth or truth. I remember, again, I'm sort of drawing inspiration probably from my case because these are the challenges I faced, and something I always needed my pediatrician to sort of guide me on. So there was this debate of, I was told that the mother's milk is the most critical thing, you know and now that your child is, it is going to help with the immunity, and the immunity is required, it's compromised, so and so forth. And obviously my mental health was not at the best frame, I was not at the best frame, there was a lot of stress involved, so I wasn't able to produce that much. And that battle of guilt of, I'm pumping every half an hour, every 1 hour, just because I've been told that your mother's milk is very important, and therefore everything should be focused on that. Cut to sometime back in my second pregnancy, which is a healthy child now, not a chd child. I was told by the doctor, even if you give 1 ounce of breast milk, that's good enough for the immunity. I mean, where does the truth lie?
So the truth lies somewhere in between. I feel that the mother's health is as important as the newborn's health. Now, just because the baby is born with a congenital heart, like I said, as long as with medication to support the heart or without medication or with surgery, we are able to have the baby put on good weight. It doesn't make a difference whether the weight is come from the mother's milk or from formula. Obviously, mother's milk, as pediatricians, we're strong advocates, but we truly appreciate, sympathize, and empathize the mother's mindset. The mother's breast milk is directly connected to the brain. This acts like a tap in the mother. The minute this is stressed, it shuts out. Beyond a certain limit, that is 2 to 3 weeks or up to a month or two, we can try with galactogog, certain medications. Mother can push herself. But the breast milk production is less than 10% in the first 1.5 month. I mean, it's pretty much okay to be on 90 to 95% top milk and 5 to 10% breast milk. That 5 to 10% is good enough for immunity. I would completely agree with that pediatrician, whoever's told you that. That's good enough to develop the child's immunity. Formula milks are excellent as compared to mother's milk. I think that's the next best thing. So if there is no option of mother's milk, without the mother being put on a guilt trip, I think it's best to keep the baby on formula. As long as there's weight gain, the baby's immunity is going to grow. Immunity also grows with the right immunization. So with the congenital heart, you should never miss a single shot because your baby's lungs are always prone to more infection. Number two, the normal exposure of allergens and immunogens around. The babies growing in metropolitan cities, they're going to build their immunity irrespective. And lastly, parenthood as a mother of a child with a congenital heart or without a congenital heart should be a pleasurable experience. It should be an experience that every parent should be proud about and should look forward to rather than putting them on the guilt and make them really second guess their decision and their ability as a parent. So I feel the mother's and the father's mental health is as important as a baby's health. Happy parents bring up happy children, healthy parents bring up healthy children. So I would genuinely feel not to stress any parent should be the key or the norm of the day.
Doctor, my last question to you: if you were to give a message to parents or mother who has just heard about the diagnosis of their child, and also to the parents or the mother or father of those who have gone through the intervention and now have to start their journey towards recovery, your important, crucial message for them?
I think congenital heart disease, if diagnosed at the right time, it's 100% treatable disease, either surgically, non-surgically, either invasive or semi-invasive or non-invasive. There is a brilliant team of doctors out there across the world who are pediatric cardiothoracic surgeons who have spent years and large number of surgeries gaining and getting their expertise. They are brilliant pediatric cardiologists. So a team of pediatrics, pediatric cardiology and pediatric cardiothoracic surgeon, if they manage to get, every parent manages their hands to get hold of such a team or have been taken care of by such a team, I can speak on their behalf that your child will have an absolutely normal and happy life. So be rest assured, just make sure you're in the right hands at the right time, and then miracles are bound to happen in the future for your children.
All right, Dr. Parikh, thank you so much for joining us and sharing your very supportive and probably very encouraging message to parents and families who would be facing such a challenging situation. And I believe with doctors like you who can, handhold, it always comes very handy. And to all those viewers who joined us right now, thank you so much. And I would urge you again to join us together for the very heartening message of Genesis Foundation, Har Dil Dhadakna Chahe. Log on to genesis-foundation.net. Give your little contribution because you will be helping one family, one more family, and their child, and helping mend their heart. Thank you so much for joining us.
Thank you for this opportunity.